Welcome. Thank you. Thank you and welcome to Inform, Immigrants and Allies, Talk Election 2020. In today's episode, we're going to talk about coronavirus and the response from the Trump administration. But first, let's take a few seconds to recognize that 209,000 people have died. Let's give it a few seconds. 209,000 people have died from coronavirus. We know the virus is bad, but we also know that many of these lives could be prevented. And those people could be at this moment with their family if the president were going to take his responsibility and the coronavirus seriously. President Trump never took coronavirus seriously. You know, he was saying that don't worry about it, when the heat comes, everything will be fine. But you know what? Let's watch this video for you to see him saying those words directly.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat.
That was irresponsible at that moment. And because of his actions, now many families are missing their husband. Many kids are crying because their parents are not coming back. Many of us are crying our friends. We're not going to be able to play soccer again because of his irresponsibility. That is something to take seriously as we move forward, because we still don't know what's going to happen with COVID. But we know if somebody can pay attention to the professionals like Dr. Fauci, who has been saying what to do, like just the simple actions of using your mask can save people's life. Just imagine if the President of the United States, with a big security, with, I am sure, a team of health professionals, got impacted by COVID, how somebody else from our community who has to go to work, who has to protect their kids, how can we imagine those people are not going to get COVID-19? That's the reality of many people living in this moment. Some people say, why those poor communities are getting more impacted than many of us? Well, many of those people are cleaning those buildings, and those buildings cannot get cleaned through a computer working from home. You know, some of those people are watching the fruits and preparing the food that you're eating at your house. Those jobs cannot get done from people's home. That's why they have to go to work. And remember, many of these people are making minimum wage that they cannot stop working in order to support their families. So there is a lot of stuff we will be talking in this show today. But you know what the problem? We still don't know when and how much more damage COVID-19 will do in our communities. But we know there is a big decision coming up soon. And I am sure you know what I am talking. I'm talking about November 3rd. There will be the opportunity to elect somebody who's going to be more responsible to our communities. So today we will be talking with professionals like Dr. Julia Kohler, who's a professional and will be providing us information. And also, we will be uncovering some myths when it comes to COVID-19.
Hi, welcome back to Informed, or welcome if you are new. Today's episode, we're going to be talking about Trump's response to COVID-19. I am Ileana, and I am currently experiencing what my doctor and I believe to be long-term effects of COVID, which I had back in April.
My name's Edwin. I am a COVID survivor, and I was going to say lack of response to COVID-19.
Oh, well, yeah.
I'm Jared. I also had COVID, and I had it for about 8 weeks. It was hell on wheels.
Yeah, and I'm Roxana. I didn't have COVID myself, but my family was deeply impacted by it. My dad actually went to the hospital for a week because of it.
And as you could imagine, we all feel very strongly about today's topic, as we always do every week. Today, we're going to talk about the myth that it's not real. And this is the myth that Trump perpetuates, or did very heavily at the beginning of the mess that started back in March. Was it March?
Yeah.
It's been a long time. And I want to make a note of this first, that globally, as of today, 10:49 a.m., before we started shooting, the 26th of September, 2020, there have been 32,344,734 cases. And of those cases, there have been 984,902 deaths reported to the World Health Organization. And from that number of deaths, 204,000 are from the USA alone.
Jesus.
But it's not real.
But it isn't real.
Right, exactly. It's all made
and it's
up.
also, it's so not real that Trump went out of his way to take hydroxychloroquine and enforce that other people take it as well. But it's not real.
Right.
And it's nothing to worry about.
Well, and with the hydroxychloroquine, right, when that all was happening, and he publicly, using the presidential pulpit, talked about hydroxychloroquine, people listened to him.
Yeah.
So there were some people who actually, hydroxychloroquine is in like what you put into a fish tank as well, and some people took the tablets that you put into a fish tank, swallowed those tablets, and they died. They died from ingesting hydroxychloroquine.
My goodness.
Yeah.
And this is something that's been used as an anti-malaria drug, as well as for patients with lupus and rheumatoid arthritis. And you had mentioned before this conversation that you know somebody who couldn't access their rightful medication because other people were taking it.
Right. So when the hydroxychloroquine boom happened, where people were thinking, oh, this is a cure for COVID, because Trump talked about it as a cure for COVID. A friend of ours, she has lupus, and she was not able to access her necessary medicine. Every single pharmacy that she called said that they were out of it, and so she actually had to try to find it in Canada.
Wow.
Yeah.
It's really shocking how, the cases really started to boom in March for the United States, but we had already been hearing about how bad things were getting in China, especially in Italy. And so we had time, to at least gather some semblance of a plan. But rather than do that, Trump really just negated to do anything federally and kind of just left the responsibility upon, states and governors and stuff like that. And while some states have fared better, such as, Massachusetts, for instance, with Governor Baker, and who's really taken steps to try to flatten the curve as much as possible, there's other states that really haven't fared any better. And we kind of need that federal step in to, step in and be responsible for these lives that are being costed.
We need this guy to be a leader.
Right.
Exactly. We're literally begging you. And also, Roxana had mentioned this to me, that Trump elected to withdraw the U.S. from the World Health Organization. Sorry.
And, the World Health Organization, which, founded around the 1940s, has kind of been responsible for, declaring when there's a health crisis and finding solutions to those health crises. They even were partially or if not fully responsible for helping to eradicate smallpox. And so they have quite a legitimate, background to them. So the act of removing us from that organization and forcing us to really be on our own and not be part of this global effort to combat this virus really showcases how Trump has taken this America first and America only approach to it.
And honestly, a lot of that seems like it's about him trying to manage his own image, right? Because Trump doesn't actually care about the American people. He cares about how Trump looks to his supporters, right? And so I don't know, actually recently, Woodward, he did an interview with Trump back in March that was publicized recently, and there's recordings of Trump saying that he was playing down this pandemic. So if we could run that clip, that would be wonderful.
That's a very tricky one. That's a very delicate one. It's also more deadly than your strenuous flus.
The admission calls into question the decision to not implement a mask mandate. The interview also shows that the president held back information that critics argue could have saved lives.
I wanted to always play it down. I still like playing it down.
Yes, sir.
Because I don't want to create a panic.
Okay, I lied. It's not wonderful. It is the opposite of wonderful, right? It is really bad. And then actually at the same time, Trump, while he was saying to Woodward, this is a really big problem, this is much worse than the flu, he was then comparing it to the flu, to the American people, and saying, oh, it's not a big deal, it's not a problem. So like these ideas of it's made up, it's not real, really start with his leadership.
He also, claims to not be nervous or worried at all about the severity of this virus, but also has people who are in any proximity to the White House or are in close quarters to him or the White House at all, tested multiple times for the virus to ensure that they are not spreading said virus.
So while he's denying it, right, and we all can't do that, he's then like super safeguarding himself, which is so like Trump.
Yeah.
And how is it not real if I had it? If Edwin had it, if Jared had it, and Roxana's family had it, and I like I had mentioned before, am experiencing what I think to be long-term effects of COVID. I don't imagine that the things that I've been experiencing health-wise would just pop up out of nowhere, seeing as I had the virus a few months ago.
I have a friend who has asthma, and he almost died. But now I think it's been 4 months since he had it. He was telling me that he can still barely breathe.
Wow. Yeah. But it's not real. It's not real. And that's just a middle school move to mask something so drastically and try to downplay something that is so incredibly important. Obviously, this is a pandemic. And then the world has shut down. And so how on earth is this something that could viably be downplayed? If we could move on to our second myth, which is the myth that it impacts everyone the same. Roxana, does COVID-19 impact everyone the same?
Oh, Liana, I have so much on this topic, It's, Donald Trump, again, in an effort to kind of quell the U.S. people into not panicking, has been saying things like, oh, this virus impacts people the same, or rather it doesn't impact you at all, it's just a really strong flu or that kind of thing. But we have been seeing that this is not the case at all, that this affects people on a social, economic, racial, et cetera, different levels. One of the biggest myths is that, this virus doesn't affect young people. And I think we can see within our own panel that that's simply not the case. But we're seeing that even if young people are asymptomatic or they don't visibly show any symptoms, they can still have, they can still have the virus, and they can in turn still spread that virus to people who are more susceptible to getting it and getting very sick out of it. As we all know that, underlying illnesses are something that really can harm you if you get this virus. If you are of a certain age, you can be really affected if you get this virus. And so spreading this myth that young people, if you get it, it's not that big a deal, that's simply not true. And
especially like if you don't want to kill your grandparents. Right?
Yeah, if you love your grandparents, then yeah. And there's a study saying that asymptomatic patients revealed that more than half of them had lung abnormalities. So even if you aren't visibly seeing, these symptoms like a cough or a fever or anything like that, the virus can still be doing its damage from the inside, even if you aren't aware of it.
And I read this on an article. It said that in all the autopsies that they've done of people who have died from COVID, they found blood clots on all of their major organs. So some people are now thinking that maybe it's not a respiratory disease. It's actually a disease that's actually attacking our blood vessels.
No, yeah, I read that, and because then they're saying that it would explain why the symptoms are so varied, why it's lungs, why it's toes, why it's this, why it's that, and quite honestly, it's not that hard to believe, and especially if it's coming from a reputable source, like people who've literally spent their entire lives studying things like this. I don't see why I would think I would value their opinion less than a reality star president who suddenly believes he is the CDC himself.
Right, and that's also just, COVID's so new, right? That we don't know all of the long-term effects. So they end up affecting someone for months and months afterward.
Right.
And we don't know what else is going to come out of that. Like, we don't know.
They're saying that, again, this just happened at the tail end of last year. So who knows what's going to happen 30 years from now, 40 years from now, what the effects are.
Yeah, and then they also keep bouncing around from saying things like, once you have it, you're immune for 3 years. And then they're like 30 days, or no, 90 days. So even things like that, we have no idea about.
Exactly, and again, going back to what I was saying previously, that this virus doesn't just affect young people, it affects all people. But especially we are seeing within communities of color and poorer communities that this virus really just rampages through these communities and just completely just ruins everything, quite frankly. All of us if we don't live in Chelsea, we've lived in Chelsea at some point. Chelsea, though it is one of the smallest cities and it's one of the smallest towns in Massachusetts, it was the most deeply affected by the coronavirus pandemic. We saw firsthand just how many people we know, people I'm best friends with, people in my own house that were deeply affected by this virus. And in our town, about 80% of people who are in our town are part of the essential workforce. So, they're grocery store workers or nurses. They're people that we need to help stimulate the economy and things like that. And so they can't necessarily take time off or work from home to avoid contacting this virus.
Yes. So my dad, he's a truck driver. So when he had COVID, he still worked anyways because he figured like people attach the load to my truck. I don't actually have to come in contact with anybody because he just drives. He'll have somebody like detach the load and then go back home. So yeah, like people in communities like Chelsea who can't take time off work because some of those jobs just don't have like paid time off or sick time or anything like that. Had to continue working while, in my example with my dad, somebody who's over 50 years old is battling this respiratory infection and still working, driving 12 hours a day.
And that's like part of the problem of not properly supporting the American public to do what they need to keep themselves safe, right? So kind of like how we don't have a new bailout bill, right? That is supposed to be there to help the middle class so that they can act responsibly during this crisis, And like in Chelsea, or really in any community that has lots of essential workers, right? Where there's middle class and lower middle class folks working there, like they are screwed in these instances because they have to go to work or else they can't eat, right? And yet it's also dangerous for them to go to work.
And there's also things that Chelsea residents already struggled with, with food scarcity, and a lot of people are undocumented and perhaps cannot receive government help. And so we kind of have to rely on work and stuff
It's
like
interesting.
that.
Sorry. It's interesting how Chelsea, often referred to as a safe haven for immigrants, documented or undocumented, made it a point to have free testing for people. That wasn't hard. That was very accessible, and that didn't ask so much of you that you would be scared to be tested, because that was a major problem and a reason for the spread in Chelsea, that people didn't want to get tested and they didn't want to stop going to work because they were scared. But Chelsea made it a point, and Chelsea is so small.
Food scarcity is such an issue in Chelsea, and during that pandemic, during that peak, they made it possible for families to still have access to it. They literally, when my family was in quarantine, we literally couldn't leave our houses. So what we ended up doing was calling, I believe, the Chelsea Collaborative, and they were able to hand deliver boxes of food to us.
Yeah. It's the same for us.
Yeah.
So I live in Revere though, but they did the same. So for me, when I had it, they had a doctor call me every day. He woke me up at 7 a.m. every day. He would ask how I'm doing, if I have any new symptoms, if any symptoms have gone away. And then they would also every day at around noon have somebody come by to drop off boxes with like pre-cooked meals that were still hot, and then also like groceries, which was actually really cool. But not a lot of other places had that, and kind of like what you were saying earlier about just because of where we are in Massachusetts, we actually have a governor who listens to his people and tries to actually help and care for the people of this state.
And that's a Republican governor who actually cares about people.
Yeah.
So it just shows that like good governance isn't a party thing, right?
Yes.
It's like a non-Trump thing.
Yeah. And if people can do that, if people can be so kind to help when they really, really don't have to, and they gain nothing from helping, there are also people who are influenced by such myths like masks aren't necessary. And with that, if we could, Edwin, talk about our third myth.
Yeah, so Trump, back in March when he would talk about masks, he would say that he didn't think that it was necessary. And, now he obviously does wear them, and he says that he wears them, but doesn't give the press the pleasure to see him in a mask. When he was being asked if he was going to put out a mandate to make it so that everybody has to wear a mask, he would say things like, no, I want people to have a certain freedom, and I don't believe in that, no. Because apparently asking people to wear a mask in order to protect others is a huge invasion of our human rights.
The freedom to what?
Taking away my rights.
Kill my neighbor? Hello?
He also has declined to be photographed publicly wearing a mask.
Yeah, because that is then a declaration and a confirmation that he recognizes the necessity to wear a mask.
And that he was called out by the press for
Exactly.
it, right? Like early on, like, you know, he's saying like, oh, you don't need it. Like Edwin was saying, like I don't want to limit your freedoms,
Yeah.
right? But then he's using it later on. So really, he doesn't care about the American people. He cares about how he looks, right? He only cares about like, I don't want to look like I'm being called out on this thing, you know?
There are so many instances where he has just downplayed the severity of this. And I'm sure we have a little clip where we can see the instances in which he's verbally denied, you know, this pandemic and the necessity of masks. If we can roll that.
Because of all we've done, the risk to the American people remains very low. People die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. But we have it so well under control. I mean, view this the same as the flu. When somebody sneezes, I mean, I try and bail out as much as possible. It's going to disappear. One day it's like a miracle. It will disappear.
And so I ask you, Mr. Trump, why you have taken hydroxychloroquine if you're not scared, if it's not real. And also, you have so many safeguards in the White House. You had mentioned before that anybody who is in close quarters to the White House must be tested multiple times. Is that what it was? Yeah.
Yeah.
And to what you were saying about him not wanting to look bad by wearing a mask, he also said, it's very simple to do. I won't be doing it personally. It's a recommendation, okay? But then, you know, months later, now he's wearing one because he knows that he was wrong, but refuses to admit it.
Right.
Please also talk to us about how he's talked about the virus just undermines the CDC.
Oh yeah. So you know, with what he's saying, he ends up running up against science very often, right? Because science clearly is saying that, like, no, these are actual good safeguards for us to use.
These are people who've studied their entire lives for this, you know.
Right.
They're kind of credible.
Right, and they published something on the CDC website. Like recently, there was a thing that came out about masks on the CDC website saying that like it can reduce they were saying it might reduce the contraction rates even more than a vaccine could, right? In some cases, and then a lot of the information about masks was immediately pulled down from the website. And people were confused, right? So then it leads to these conflicting messages that you're getting from the federal government and the CDC, but the CDC is the federal government. Yeah. And so then what ends up happening is this institution, the Center for Disease Control, which has been so reputable in the world and places like the World Health Organization, becomes undermined. And so now people say, can we trust the CDC? We don't know, you know?
And then to what you were saying about the CDC, right? And early on, he would twist a lot of the things that the CDC was saying, and also things like what Anthony Fauci was saying. But he would say that those people said that we shouldn't be wearing masks. But although they did say that early on in quarantine, it was because they were saying that we should limit that to people who are working in hospitals. Yeah. So we should limit our use of masks so that people who are working in hospitals can have access to them.
Right, that shortage of PPE was designed so that hospitals could provide their PPE, right? Yeah.
I think to close, I want to mention that wearing a mask is for the benefit of the people around you. Like Roxana had mentioned briefly before, in America especially, or the US, there's very much the all for one mentality, the I go first, I'm more important than anybody else. And I just don't think that is fair. This entire show is against that mentality because we want you to go out and vote for the betterment of everybody. Because I'm not the most important person in this country or in the world, and neither are you. So with that, everybody mask up. I'll put mine on in a second. I got to talk to y'all still. Stay safe, stay informed, stay tuned, actually, because we're going to have somebody with an actual head on their shoulders. Her name is Dr. Julie Kohler, and she is with the Boston Children's Hospital in Pediatrics and Infectious Disease. Join us next time.
Hello, everyone. Thank you for tuning in to our show, Informed. My name is Marshall Martin, and here we have Julia Kohler, who is a pediatric infectious disease specialist at Boston Children's Hospital and an assistant professor of pediatric at Harvard Medical School. Say hello, Julia.
Thank you so much, Marshall. It is a pleasure and an honor to be here and to be able to speak with you. Thank you so much.
Thank you so much for giving us your time of day to come here and just, answer a couple questions. So why don't we just start off by just talking a little bit about like who you are, what do you do, and like how did you get to where you are?
Sure. So I specialize in infections of children. So first I had to train in First I had to go to medical school. Mm-hmm. I did that in Germany, my country of origin, where medical school is free. Then I had to do training in pediatrics. I did that at Boston Children's Hospital. And then I had to do training in infections of children, and that I also did at Boston Children's Hospital.
So why don't you just talk a little bit more about like your experience with like COVID-19, whether it was like what your job field was looking like during, the entire pandemic from like March to now, and what knowledge you have about it.
The thing with COVID is, among adults here in Massachusetts and in Boston, disproportionate numbers of Latino and Black people got sick and died. But also, once you've recovered from that disease, are you going to bounce back and be to the state of health you were before? Often that's not the case. Mm-hmm. So we're talking about long-term disability, and so that injustice to me is really the most unacceptable because unnecessary feature of COVID, really. It didn't have to be this way. There's no reason it did not have to be this way. And so that's what I've been thinking about a lot, since these facts started emerging. Mm-hmm. It was like maybe early April, a friend of mine who works at Mass General, which is a big adult hospital, she said, do you know that we're seeing really almost overwhelmingly Spanish-speaking patients. Those are the patients in our ICUs on our ventilators. And I thought, wow. So I do think this was foreseeable. It could have been prevented, and it wasn't. Mm-hmm. And I actually think even now, let's say, which is quite possible, that infections increase again, it still isn't being prevented. So exactly. The thing that I found so profoundly shocking in this whole last 7 months was the differential value placed on people's lives. Yeah. That honestly I would not have expected in this harsh form, and that even when terrible things were seen to occur, nobody who had the power to do something about it jumped in.
So you touched a lot on like immigrant health and how those with immigration status have been affected by that. Mm-hmm. What I also want to know is like your insights on some of the like myths and like misinformation that are just surrounding the virus.
So, it is true that the older we are, the more likely it is that it's going to be a serious illness, but young people can get it and young people can die from it. And right now, I really see no reason not to wear a mask. It's like somebody said, people are kicking and screaming about wearing a mask. We just get used to wearing underwear too. You know, am I gonna? I don't leave the house without my underwear on, and I'm not gonna leave the house without my mask on.
Yeah, it should just be in another accessory that's always on you. You know what I mean?
Exactly. It
Another
should
piece of
always. I think it's true that if everybody wears a mask all the time, except if you're at home with people that have the same exposures as you do, but if everybody wears a mask all the time, we could protect ourselves quite well. We could knock the infection rate way down.
Yeah.
Honestly, you couldn't pay me enough money to have dinner in a restaurant inside. No, absolutely not. No, no,
Not $1
no,
million.
no, no. No, not $1 million. No.
Yep.
Because of course, when you're eating, you have to take off your mask, right?
Exactly.
So the mask is missing, and you're indoors.
So that's two red flags that we already just
Two
talked
red
about.
flags.
Yeah. Everybody follow Julia's advice, and any news that you read about, keep yourself up to date with all the recent information about COVID. But thank you so much, Julia, for coming on and talking with us. It was a pleasure to have you. Would you like to say one last thing before we sign off?
The election will be challenging because we need to stay safe, and at the same time, we have to vote. We have to vote as if our lives depend on it, because they do. We have to have a government that can help bring this pandemic under control, and right now we don't have one. That's it.
Thank you. Thank you so much for listening to Informed. Please stay up to date with our episodes so you can learn more about what's going on in the political world. From us to you, stay safe, stay healthy, stay informed. Bye-bye.
The wrap up. This is our show in 2 minutes. Our show is Informed. Immigrants and Allies talk the 2020 election. Today's show is about COVID-19, or coronavirus, the ugly dude with spiky hair who keeps ruining all of our birthday parties. Trump will say he's done a great job dealing with the virus crisis. But with tens of millions of people unemployed, evictions on the rise, no plan forward, maskless science deniers out in force, and over 200,000 people dead, Trump's declaration feels like Nero standing over Rome with a torch in his hand saying, "I did a good job." And now Trump, along with the throng of administration officials, got COVID. He's even trying to play that off like he's heroic. He literally wanted to wear a Superman shirt as he limped out of Walter Reed. Before declaring victory, the Trump administration tried to downplay the pandemic for months, feeding the conspiracy theorists claiming the virus was made up to control us or claiming it was just like the flu. They even tried to undermine the authority of their own health officials, like Anthony Fauci. Dreamy, steamy, doctorate-awarded Anthony Fauci. But COVID is real. Over 1 million people have died worldwide, and there have been more than 37 million cases. Friends, neighbors, and loved ones have had their lives irrevocably changed by COVID, and more than 200,000 people have died in the U.S. alone. But not all people have been impacted equally. Immigrants and people of color have been harder hit by the pandemic because many of them are our essential worker heroes. They can't work from home while baking bread with a mocha latte and a Snuggie. They are doing the hard work in our hospitals, food preparation facilities, and our public spaces. But instead of thanks, good public safety measures, and proper sick leave, people are left without government support, and they are falling ill, along with their families. Remember, this could have been prevented. Denial was not the responsible decision. One thing Trump could have said was simply, wear masks, as recommended by his CDC. But instead he said, so it's voluntary. You don't have to do it. I don't think I'm going to be doing it. That's not the soundbite of a responsible president. That's the sound of Uncle Charlie outside the Packy talking with his buds. So let's ensure he isn't our president anymore and vote him out of office this November. So, if you can, stay healthy, stay safe, stay informed, and vote. See you next time.
So thank you for staying with us. I hope we have been able to provide you some information and also uncover some myths. Dr. Calder, I hope she gave you some information on how to save people's life. At the end of the day, you have to make your plans to go out to vote and vote as if your life depends on it. Because that's true. That's what is on stake for many of us. November 3rd will make a big difference in our life. So stay healthy, stay safe, stay informed, and make your plans to vote. Thank you.